Without further ado, I want to introduce Jay Keese, who's the executive director of the DPC coalition, and Jeremy Schupbach, who's the national director of government strategy at Proactive MD. And Jay and Jeremy are going to have a great conversation about the future of DPC after the election. We're in a tumultuous time. 2020 has been quite the year. There's no way around it. It seems like a year with existential threats around every corner. But the one bright spot is DPC, and the future of DPC looks good no matter what happens after the election. And so Jeremy and Jay are going to dig into that. So without further ado, I want to introduce Jay Keese and Jeremy Schupbach.
Hey, Nick, thank you. So as you can see, I mean, everything that we're dealing with in Washington, D.C., and you're dealing with in the United States of America is certainly colored by the coronavirus pandemic. We have a pandemic. We have riots in the streets. I think in a large part due to the realization that of the disparities that have been put forth and so glaringly shown by the pandemic. And, you know, if things couldn't get any more interesting, you know, our beloved Justice of the Supreme Court, whether you're a conservative or a liberal, I think everybody agrees that Justice Ginsburg was, in fact, a beloved figure, passed away, you know, days before the election, essentially, throwing into chaos a city that was already there, deeply into chaos. I think it's fair to say that over the course of the next few weeks, anything that happens in Washington will be about the Supreme Court nomination. And of course, that has, you know, great implications for healthcare. Understanding that the Texas-California case could, in fact, you know, lay bare the entire Affordable Care Act and overturn it. Just last night, as we'll discuss in a few minutes, the president laid out an executive order to ensure that, you know, some of the things that they want to protect that are in the Affordable Care Act are, in fact, you know, protected, such as exclusions against pre-existing conditions, and yes, direct primary care. So, of course, the first place the words direct primary care were ever written down in the law is the Affordable Care Act. So what could that have to do with things either before or after the election that you know, could wind up in the hands of the court? So we're gonna dive into that a little bit and look at both of the candidates' stands on healthcare and look at some of the things that have happened both from the coronavirus pandemic and through other policy decisions that have been made and executive orders that have happened here in Washington that have a real impact on DPC. But first, let's talk about politics. I mean, I think everybody knows this is close, and frankly, you know, as a citizen, as somebody that cares about DPC, as Jeremy said, you know, we think we're in great shape. DPC we've bent over backwards to make sure that people understand that this is about better healthcare. It's not a partisan issue. What's the one thing, you know, one of the very few things that the president supports that's in the Affordable Care Act? Direct primary care. You know, I mean, we have sponsors of bills on the far right to you know, Senator Paul and Senator Cassidy, on the far left to you know, Representative Blumenauer from Oregon, and even the late John Lewis was a supporter of direct primary care legislation. So we really have done a good job at making this a bipartisan issue. But the race is close. And if you look at, this is my favorite source for electoral information, Charlie Cook, the Cook Political Report, says as of last week, and this hasn't really changed on his website, the 270 electoral votes needed to win, Democrats currently stand at 290. Well, that looks like it's a great thing for Biden, right? Well, take a look at where the toss-ups are. You know, there are 61 electoral votes in toss-up states, Florida, Georgia, Maine, North Carolina. There are another 140 electors that are up for grabs in these, you know, sort of leaning states. So get out and vote. One of the things that's at stake beyond the presidency is the Senate. Currently, we're sitting at 47 Democrats, 53 Republicans, a pretty narrow majority for the Republicans, as you can see in the thrum and drang over the Supreme Court issue. I think there's really, if you take a look at these seats that are, again, in the toss-up and lean category, there's a lot of Republican seats that are up, and there's only one Democratic seat that's sort of leaning Republican right now. And unfortunately, he's one of the co-sponsors of our Primary Care Enforcement Act, Senator Jones. But I think if you look at what's going to happen, it paints a picture of, frankly, possibly a toss-up Senate. What needs to happen is that the Democrats need to win 4 seats. If they have the president, they can have a majority with 50 seats. With just winning 3, it's looking pretty likely with some of these races that might happen. Whoever controls the Senate, it'll be either a 50-50 Senate or I think a 51-49 Senate. I mean, whether there's Democratic control or Republican control. So then the margins that we have now that have created a little bit of this chaos are going to maintain, their narrow character. So I think when you start to look at where some of the candidates stand, we've heard an awful lot on the Democratic side about Medicare for all. And so clearly you've all heard that Vice President Biden does not support Medicare for all. His running mate at certain points, has supported it and has, sort of modified her stance. But the reality is what the Biden campaign is saying they want to do is create a Medicare-style public option that would be available on the insurance exchanges for the uninsured, for states that have not yet expanded Medicaid, or for people that are simply unhappy with their employer coverage. So I think it's important to understand that, while Medicare for all seems scary, with a 51 Senate, you're not going to have the votes to get to Medicare for all. Frankly, I don't know that you're going to have the votes to get to a public option. So some of these other things you look at, increasing the premium tax credits to improve coverage and lower deductibles, lowering Medicare age to 60. I mean, I highly doubt that in a 51-seat Senate, one way or another, that there are going to be the votes to move the mountains needed to move the Medicare age down to 60. Things like doing surprise billing to prevent ER docs and anesthesiologists and pathologists from doing out-of-network billing. I think everybody agrees we could do something on that. And obviously all of the efforts that are being taken both legislatively and by the administration to reduce drug prices, I think will continue. But some of the big picture items you see at the top of the screen, they're going to be hard to achieve with a 51 vote majority. So we look at President Trump's campaign, and of course, yesterday we had an executive order that we'll go through here. The priorities are, candidly, a lot more of the same because they haven't had the votes to do what they want to do, which is repeal the Affordable Care Act because of the narrow margins in the Senate and the House. The president has really done policy by proclamation. He has done one executive order after another, many of which have involved DPC. But, you see, obviously, they're focusing on returning back to normal in 2021, developing a vaccine by the end of the year, making sure that healthcare workers have the supplies and medicines that they need to get them to the population. And again, cutting drug prices, ending surprise billing, covering pre-existing conditions. So I think a lot of you may have seen yesterday the president made a speech and issued another executive order, really trying to say essentially that even if they overturn the Affordable Care Act, that they are not going to do anything to get rid of the pre-existing conditions ban, and that they will support legislation to move forward on a surprise billing regime. And if they don't, they'll do what they can administratively. But in the press release that came out today, rest assured, the administration remains committed to direct primary care. President Trump will improve access to direct primary care arrangements, cutting out the middleman, cutting out the red tape, and enabling patients to spend more time with their doctors. So clearly, in addition to the support that we've seen on the Democratic side, we have support with this president. So moving forward, if it's a Trump presidency, even with narrow margins, I think we can see continued efforts like the executive order that we had on transparency, which promulgated regulations just this June that would treat IRS expenses for health savings accounts, would propose to treat IRS expenses as with regard to health savings accounts as allowing DPC to be eligible. Now, I think a lot of you have seen the regulations that came out from this, and like many regulations, they are certainly far from perfect. We're really glad that they clarified that DPC is compatible with HRAs and FSAs, but the HSA question is still out there. And it really sort of harkens back to this idea that primary care does more than prevention. It is some form of other coverage or some form of insurance coverage that gets between the high deductible health plan and the HSA. And the laws say if you have an HSA, it has to be paired with a high deductible health plan, and you can't have any other coverage, such as the way IRS interprets DPC, such as DPC. So we're still trying to work through that. Just this week, the IRS announced that there's going to be a public hearing. We've submitted a request to testify, as I'm sure many people probably in the audience have as well. And you know, the deadline to submit testimony would be tomorrow, this evening at 5 o'clock. If you want to testify, you've got to get on this page at regulations.gov and sign up to testify. I don't know that there's going to be an ability for all the doctors that submitted comments to this rule to get on and testify, but we think we'll have a good shot at presenting testimony. And in that testimony, we're going to simply say that the IRS needs to take a second look at these rules and really create space for DPC as a primary care service that's all about prevention. Primary care is primary prevention that is accepted from the rules that look at these arrangements as other coverage or insurance. You know, we worked really hard to make sure that people understand that DPC is not insurance. And Jeremy's going to talk in a minute about some of the 30 plus states where we have passed legislation or good regulations that say direct primary care agreements are in fact not insurance. They are medical services to provide prevention and primary care. And they do not run afoul of state insurance regulations, and they're not regulated by the insurance commissioners, that they're regulated by state medical boards like any other medical service. So we're going to continue that work regardless of who's in charge. I thought it would be good to sort of run through quickly, and these slides will be available to you, some of the things that have been done in the reforms, both through the CARES Act and through administrative action on the COVID reforms. Now these HSA restrictions have been eased somewhat temporarily for DPC arrangements that are done through employers. So right now, and these are done under the guise of telehealth. So this really only counts for a virtual visit, not a DPC visit. But there is temporary relief for employers who want to offer their employees a benefit with a DPC provider offering telehealth arrangements that could be compatible with an HSA HDHP plan, and these would be compatible before meeting the deductible. So we're chipping away at this. We've gotten the Primary Care Enhancement Act in the first version of the CARES Act. It didn't make it through to the final version. If they ever get around to doing another coronavirus relief package, we're pretty certain that we'll get further relief on this. Whether it'll be permanent or not is up in question, but we've been working hard to make sure that DPC is represented through all this. And your work out there has been just instrumental. I really appreciate all the kudos we got from Julie and Clint and others that had mentioned the work that we've been doing with physicians around the country to really support the direct primary care model and make it first among all of the value-based payment models. And we'll continue to do that regardless of who's in the administration and who's running Congress, because we've got a good bipartisan message. So I'll just end here and turn it over to Jeremy, and we'll talk a little bit more about things that are going on in the states. These slides will be available to you. They will be up on the DPC Coalition website as well, and I'll be happy to take any questions.
Great. Thank you, Jay. Great presentation and a great overview. I think the highlight there is that like you said, it's not the Flight 93 election. This isn't do or die. We have bipartisan support for direct primary care and physician-based services throughout the states. I think we're laying a lot of good, solid foundation for the services we provide and the kind of care that direct primary care really is. But with some of the things that I think resonate and you talked about at the federal level are going to be slightly different from state to state. And that's because the legislators are different and because states are experimenting with policy and with healthcare regulations in different ways. And so what I want to talk about here is just how states treat things differently and how you as an individual provider, as a DPC doc, need to stay engaged and aware and informed of your what's going on in your community and your state. The DPC Coalition is a great way to do that. Get involved with Jay, get involved with the national organization, but also get to know your state legislators, get to know the policymakers at your state level, and then really invest yourselves in what's going on in your community, because the care that you provide and the reputation you build up for the kind of services that you do, and direct primary care is by reputation, really does affect state policy. And in my experience, what you really see at the state level when legislators meet is they want to talk about stories. They want to hear from their constituents. They want to know what's going on in the ground. Every time that I've seen testimony on medical services, direct primary care, health insurance, health issues in general, from injections to surprise medical billing at the state level, the stories of constituents and people who show up and testify, who can relate, who connect with their legislators and connect with the community around them, are the most powerful. And so getting engaged like that is a really powerful way to affect not only care in your community, but what's going on at the state legislators. And so just to highlight a few things that I want to talk about, and you see different state legislators experimenting different ways. In Washington, the State Insurance Commission is taking a much closer look at DPC, how it's regulated, how the reporting requirements are being done, and that's at a regulatory level. So states are starting to tread into that. In Colorado, we are experimenting with public option legislation that will affect just Colorado's citizens. And so while it's not likely to happen at a nationwide level, the hotbed of policy experimentation that is the states is going to give Colorado citizens an opportunity to decide whether or not they want the state to be far more involved in state legislation. And what we've learned from COVID is that states are becoming much more empowered with how they purchase healthcare, with how they regulate healthcare, and with how they organize themselves. Just witnessed like the N95 pandemic, within the pandemic around PPE. States were purchasing, states were competing with other states, states were competing with the federal government for at least the first 6 weeks of that pandemic. States were trying to get organized and find the information, find the materials, find the protections, find the equipment that they needed to protect themselves and their citizens. And what they've learned from that is that they can aggregate and they can purchase and they can organize and they can regulate in different ways to change the shape of healthcare along different scopes. You're going to see Republican states, Republican-led legislatures respond to that differently than Democrat-led legislatures, and you are going to see some of that partisanship play out at a state level that I think is going to be very different than what you're going to see at a nationwide level. So again, reiterate kind of what Jay said, not the end-all election, not the Flight 93 election. We can deal with DPC because we are bipartisan, because we tell community stories, and because we change people's individual lives in a much more powerful way. But we are going to have to react differently state by state, and how it looks to you as an individual provider is going to be different depending on where you practice. A practice in Nebraska is going to look different than a practice in California, and a practice in Colorado is going to look different than a practice on the East Coast, just by way of regulation. I will say though, however, that what we are dealing with and what we have opportunity to do is make sure that we've carved out those spaces for DPC where we make sure that we are not regulated as insurance, that we have the opportunity to provide community services, and we have the opportunity to come back and to be involved in the community level.
Jumping right in here. So Jay, can you level set for us? When you just take a look at the long view, how far has DPC come in legislative considerations and conversations over the last 5 or so years?
Oh, Zach, it's come a long way. I think you were with us 5 years ago on some of the marches we did up on the Hill, where, you spent the first 15 minutes of a 20-minute meeting describing what DPC is. We don't do that anymore. Everybody understands it intuitively. The initial reaction we get when we have a meeting on Capitol Hill or with a regulator is, how do I get this? So it's like everybody else in the world when they really hear about it. People want it, and people want to help it along. So I mean, you look at every single policy that comes out. One of the things I didn't mention is we're working directly with the CMS right now, and the president mentioned this in his speech yesterday on continuing to evolve the direct contracting and primary care first demonstrations at CMS so that we can bring services like DPC to people in Medicare. So trying to the fact that we actually got there has been amazing, and we've covered a ton of ground. I mean, I'd say passing 33 state laws and regulations in a period of less than 10 years that all pretty much say the same thing really I mean, my 30-year career, we've never done anything even close to that. So there's been a ton of movement, and we need to continue to stick together to push this thing along. But I appreciate the question, because there's been a lot of work done. People that are in this meeting, on this Zoom, on this HINT Summit, have left a lot of sweat equity behind to make sure that this is an issue. It's a bipartisan issue, and it's one people care about every time they talk about health issues.
How enforceable and sustainable are the executive orders that have been made? And, have any of them made any real change?
I think they have made a tremendous amount of change in terms of raising awareness. They are, first of all, I will say that these really do hinge on this court decision, candidly. They are almost all, so the thing about an executive order is it has to be based in current law. In other words, the president can only do what he's empowered to do under current law by sort of reinterpreting things and making sure that there's an understanding of, okay, we have pre-existing conditions prohibitions, now how can we drive that further? Okay, we have direct primary care in the Affordable Care Act, how can we drive that further? So if you repeal the Affordable Care Act and it goes away, lock, stock, and barrel, almost everything that happened in the executive order goes away. So there are some threats. There's also the ability of the next president who comes in to just say, hey, under executive order, I rescind those old executive orders. So they don't really carry the force of law. But I will say that the things that have happened for DPC, such as the moves in telehealth, such as the moves in IRS and other issues, they have a lot of bipartisan support. And in fact, even the DPC demonstration, the direct contracting demonstration at CMS, I don't think you'll see a Biden administration unraveling those just because they were Trump's ideas. First of all, whether these are Trump's ideas or not, that's why I did the air quotes. These are ideas that were around before President Trump. They'll be around after President Trump. They'll be around after President Biden, Vice President Biden, if he gets elected. So, I think the reality is the executive orders have been incredibly helpful. The legislative progress in the states has been incredibly helpful, and it all adds up to good sausage making. It's all part of the process.
Sorry, under the temporary telehealth legislation, can DPC be paid with HSA through 2021?
I don't believe so. Jay, correct me if I'm wrong.
So under
that, but HSA is still bifurcated.
Yeah, under a very, very limited set of circumstances, if the employer offers the DPC arrangement, through the employer health plan, as a combined DPC insurance plan, then yes, as long as they are only telemedicine services and you don't do an actual in-person visit, that is through 2021. That should be that should not run afoul of the 223C regulations. But if you're an individual that has an HSA and it's not linked to an employer plan, doesn't count. Right. If you're an individual doc and you want to do an in-person visit, doesn't count.
Right. I think to underscore what Jay was saying, especially, I'll use air quotes to the Trump executive orders, what they've done is open the door and set the stage. Right. And I think it's unlikely that we're going to see the policy rollback, even executive order rollback, in terms of actual policy. And what the executive order for HSAs does is allow for the precedent to be set, and people to look at it and say there was no damage, no harm done. This was a good idea. It helped people. Let's build off of this platform. So if anything, it's kind of a springboard that I think we can take advantage of.
Thanks so much. So when do we expect the IRS to finalize the regulations? Do you expect any major differences from the draft?
Well, I will say the fact that they
and by the way, it's the IRS finalized the regulation that it's taking comment on.
Yeah, I would say that
Yes.
the fact that they moved so quickly on this hearing is a very good sign. There were 12,000 individual comments on this proposed rule. That's an awful lot. That's a huge number of comments. And in fact, the IRS does take this process very seriously. So I do believe that there is a possibility that we could get IRS to change the definition they have in there that really makes DPC look like coverage and make it look more like a prevention plan, which is already permissible under the law. So I don't know when they will. They're not bound by any time. The executive order outlined that they were supposed to promulgate regulations within 180 days. It took them a year. So it's hard to tell. But they are working hard at this, and I do believe that these regulations will go final, and there will be some level of relief, at some time. If I were this president, I would make damn sure it got done before he left office if he's going to leave office. So let's see how things turn out in the election, and that could put some additional pressure on the administration to get things done. If in fact they don't win, candidly, and if they do, I think they'll continue to push hard.
So I agree with that, but I will say that bureaucracy has earned a well-deserved reputation for not being the quickest and most efficient way to do governance. That being said, we're setting a direction that I think is going to be really helpful. And to that end, I think what you're going to see is not only those regulations go final, but there will be some changes to it. I think 12,000 comments, and you figure 4 pages a letter, that's 48,000 pages worth of comments on a rule on the IRS. That's relatively unprecedented. And so I think that's part of the groundswell that we were talking about, the community engagement, the community involvement, that really is going to help tell the DPC story and really push it further into a platform that is bifurcated from being insurance and at the same time being able to be paid for by some of the vehicles and some of the companies and some of the employers in ways we're just beginning to see the pandemic take shape on. So I think we're at a good sign.
So, questions coming through. If you had to prioritize, what are the primary challenges to passing the broader non-partisan legislation that will best support DPC's growth over the next few years?
For me, I think the biggest challenge is just getting the attention of the federal government at a level that can allow things to go forward in a bipartisan fashion. What we talked about at the beginning of the slide, you're looking at an incredibly partisan election. The Supreme Court nomination and the vote to confirm process, the way that politics in the House is shaping up to just be he said, she said, getting bipartisan to actually work is something of a challenge. If you can overcome the hurdle of both parties actually working together and having 2 or 3 main points they agree on, that's going to be the biggest hurdle. Once we can unite on a couple, 3 major points, then I think legislation has a chance of moving forward. The last thing I'd add, and then I'll turn this over to you, Jay, because this is really your area of expertise, is again the speed at which things move. And the federal government moves much more slowly than states do, which is why I'd like to come back to the idea that states who are experimenting with the idea of DPC and promulgating DPC or doing waivers and pilot projects with state programs might be a way to move that ball forward. So I think states are going to move much more quickly on that than the federal government will.
I couldn't agree more, Jeremy. And I would add one more thing. We need to speak in the DPC community with a unified voice. And what we need to do is we need to tell people what it is that we do. What do you do as a DPC doctor? I think there's been a lot of folks getting caught up in the minutia of the regulations and legislations. And candidly, that's one of the reasons we have the coalition, so that we can talk to the experts in DC and figure out a way to make what it is we all agree on happen. And we agree that direct primary care is the best possible care anybody can get in America today, and that we ought to expand it to every American, regardless of their age, their income, their color, their race, their creed, and everybody ought to have access to it. So let's all get together and try to figure out a way to do that together with one voice, rather candidly than arguing over where the comma ought to be in the middle of a regulatory sentence. So I think speaking with one voice is the way to move forward. Keep this bipartisan effort up. Don't make this a Republican thing. Don't make this a Democratic thing. Make it an American thing and make it the right thing to do for healthcare, which it is.
Yeah, I couldn't agree more.